At a state Senate hearing this month in Columbus, person after person appealed to the Health, Human Services, and Medicaid Committee to make a bold move in Ohio on how racism is defined.
We are tired that history's only solution to flattening the racist curve is for us to lay down. And that's why I'm standing up here today. I was just going to send in my testimony, but I'm tired of laying down.
The Senate committee is considering a resolution declaring racism as a public health crisis.
A public health issue is something that hurts and kills people or impedes their ability to have a healthy life.
Hamilton County Commissioner Victoria Parks is also working on language to present locally. State Senator Cecil Thomas is a co-sponsor of the Senate resolution.
When it comes to finding affordable housing and getting access to quality health care, getting access to quality education. When you start looking at the much deeper issues, you begin to look at there's one common denominator, and that's racism.
Thomas says it's an uncomfortable conversation, but one that's needed.
I would fully support the notion that racism is a public health issue and responsible for a large percentage of our healthcare disparities.
Dr. Christopher Lewis is the vice provost of academic programs at UC. He also teaches in the College of Medicine and is a family physician.
Healthcare is more than just medicine and disease. It has to do with other societal factors as well. Economics, access to education, housing, access to clean water, employment.
They're called social determinants of health, conditions that impact our health and health outcomes, according to the CDC.
All of those sorts of things that many people take for granted do impact the health of a whole lot of people in our region.
Meanwhile, many hospital groups in town have already begun implicit bias training for workers. But Dr. Lewis says more minority hiring is needed.
We're really floating around a 2.4% African Americans physician workforce, which compared to the average of over 4 is, we're almost half of that.
Health disparities are often higher for African Americans, potentially the result of racism that has accumulated and compounded over time, according to Dawson. And the CDC is noticing another trend, higher rates of conditions like heart disease, diabetes, and stroke at younger ages. And now there's COVID-19.
The current COVID-19 pandemic reveals that nationally, Blacks are on average 2 times more likely to die from COVID-19 than the general population.
Meanwhile, it's not only physical health that's impacted. The recent deaths of George Floyd, Ahmaud Arbery, Breonna Taylor, Rayshard Brooks, and many others has some people needing mental health counseling.
Here recently, I've gotten a lot of calls and referrals for not only African American females, but also a spike in African American male referrals and calls.
Dr. Dewana Lenoir is a psychologist and owner of Live Well Group in Blue Ash. After weeks of protests and demonstrations locally and around the country, the videotaped deaths, the 8 minutes, 46 seconds, is all taking a toll.
Men are honestly very honest about being concerned for their own safety and being concerned about being a Black man in the world.
Well, we began this segment, of course, talking about those racially charged comments from State Senator Huffman, and many people don't know this, but it actually happened during a hearing to consider racism as a public crisis. Lisa, some might say that this is the problem really in plain sight.
Yeah, Tamika, I asked Senator Cecil Thomas about that. He was at that hearing because he's on that committee, and he said when he heard those comments, that he was just floored. Possibly because here this was a state senator and also a medical doctor who was making these comments, and it just kind of reminded him of the point about implicit bias and some of the things that they're trying to make sure are dealt with what this resolution is trying to do. So they really want to see the governor come up with a plan where there is a working group. They want to look at legislation. They want to look at the Ohio Revised Code. They want to look at hiring in the state and promotions and the way money money is spent. They want to really make this a very broad-based attempt at trying to level the playing field across the state. And so, there was also some testimony that was presented in written form from someone who is a medical resident. And they talked about how they observed a person getting delayed health care basically because the doctor who was in charge of the ER, there was a woman that came into the ER. The doctor apparently said that this woman was, quote, another black junkie. And actually, it turned out that this person had had a major stroke. And there was a delay in her getting treatment because she was kind of pushed to the side because of an assumption that was made about who she was and why she was in the hospital.
And so, as we talk about policy changes and things of this nature, Lisa, what have you heard, or maybe anyone else on the panel, where do we kind of go from here?
I mean, we did hear from the governor earlier this week, list out a number of changes more so for police. I think it sounds like there is a desire to see broader changes. Obviously, I don't think anyone is going to, not be okay with seeing some kind of change, but I think that people who are really looking to see some change happen, they are looking to see this happen over the long haul. So I think this is going to be something we're going to see going on for a while.
And that's the key, having those long-term solutions. Thank you so much, Lisa, for that report.